So here we are. Leaky gut. What is it and why does it even matter? So I'm Mary Scalf. I'm one of the physician assistants here at the MaxWell Clinic. So if you're new to functional medicine, or maybe you've been with us for a while, you might be wondering why we care so much about your nutrition, why we ask so much about your poop, your stress level, among other things. It all is connected to gut health, gut function, and what is kind of maybe causing gut leakiness. So if you have attended other group visits, you'll have learned maybe from Dr. Ferris or our dietitian, Allison Molinares, about the gut microbiome, the importance of probiotics. This is going to kind of build on some of that. You may have heard it discussed that our gut has over 70% of our immune function contained in it, that our gut also houses over 100 trillion microorganisms. So we are more microorganisms than we are our own cells. So when you have so much of your immune system in your intestines, this can work to create health, and it can work to unravel health if it's not functioning well. Our digestive tract is amazing. If we were to lay it out flat, expand it, its surface area would cover nearly 2 tennis courts. All of that contained in a short little area in our abdomens and our bellies. I find that amazing. Also, it gets more interesting that our digestive tract is essentially a tube, and it's the only thing separating the rest of our body from the external environment. That's kind of scary, but it does a really good job when it's functioning well. So your digestive tract is going to be exposed to more antigens. Antigens are the things that are going to trigger your immune system. You're going to be exposed to environmental antigens, imbalanced bacteria or dysbiosis, dietary antigens, viruses. Yeast are supposed to be there in certain quantities, but your gut is going to be exposed to more of this, and your systemic immune system is your entire life. So your gut barrier is so vitally important. Hopefully you're starting to shape that. I'm going to build on that case a little bit more. So your gut barrier is only one cell lining thick. Those cells make up the endothelial tissue, and these cells are called enterocytes. These enterocytes are very, very smart. They're very, very specific. I like to, it's good to know kind of what our normal functions of our gut are. So a healthy gut, leaky gut, what is that? What is that again? Leaky gut, I also want to say, has other names. The more kind of medical term is intestinal hyperpermeability or increased intestinal permeability. Your gut has normal functions of digestion, absorption, elimination, and defense. It's supposed to break down your foods, get the nutrients it needs to help reabsorb those into your system to get those nutrients to other organs and other tissues that need that. So it has to know what's good and what's not. That's part of the absorption. We want to get rid of the things, the viruses, the bacteria, the yeast that aren't supposed to be there, the food products we don't need through waste. And defense kind of gets to our immune function there. So if any of these functions are impaired, we can start to see dysfunction occur that can unravel our health and lead to chronic diseases and chronic inflammation. So in that one cell lining thick that separates you between the rest of the environment, outside environment, those enterocytes, and that intestinal lining, you have this, it's called gut-associated lymphoid tissue, GALT. And GALT is that immune system in your gut. And like I said, it's intelligent, it's selective, it's got to know when, as things pass through the system, what gets let out into the environment, and it rejects the things that don't need to be. Toxins, again, bacteria, viruses, yeast that don't need to go into the system. And what's interesting is that it spends more time, not reacting than reacting. Our immune system should be functioning so well that we don't even know that it's doing its job. It saves us from so many things that we don't even realize or appreciate. So if you're doing well, thank your gut. And if you're not, let's work on it. It's kind of, when this starts to break down, that creates that permeability. And it's that selectiveness of those enterocytes that are bonded together so tightly with tight gap junctions that allow us to be so kind of not reacting to everything. So if you think about it, there's a reason why we all breathe in pollen, but we don't all have allergies. There's a reason why we all eat food, but we don't all have food sensitivities or allergies. So your gut is going to be a gatekeeper. It's going to let things in that are vital for life and let things kind of occur as they should, and also protects us from so much more. We can have kind of leaky gut nearly, honestly, anywhere in our digestive tract. Even hyperpermeability in the esophagus leads to chest pain from acid reflux. So this is going to be occurring there, in the colon, in the small bowel. So normally a gut is supposed to function as a unit. So this is your healthy intestinal lining. These are those enterocytes. They're all nice and snug together, they're buddies. And there's kind of your blood vessel. That's what a healthy kind of gut barrier is going to look like. It's going to function as a unit. It has these tight-knit wall to protect us. It's going to keep bad bacteria and toxins from reaching into your blood cells. Nothing's getting through that. All the meanwhile, it does decide when healthy things go either through between the cells, or they can go through the cell themselves into your bloodstream. So if the gut barrier starts to break down, these junctions loosen up. These junctions stop being so selective. They aren't as good as they were before in keeping out bacteria or viruses or toxins from getting into our bodies. So then we'll start to see widening of those, what should be tight spaces. We see the ability for those larger particles, bacteria, viruses, or toxins to get in. And then they end up in our bloodstream. So when the gut lining becomes inflamed, the gut gets sick. Leaky gut. So I think that kind of the easiest thing to think about this is comparing this to, if you like coffee, comparing this to how we make coffee in a drip coffee maker, right? We usually use a coffee filter. We put the ground up beans in that coffee filter. The water should be in the container. We start it, and we just want that nice black dirt water of coffee in our cup. We do not want coffee grounds in our cup. I don't like that. I don't know about you. So if our gut barrier is functioning well, it's like this, it's like a coffee filter. It doesn't have any holes in it. We're just getting that sweet nectar of life coffee, and we're not getting the grossness of grounds. If there's holes in that filter, you're gonna get a mouthful of grounds in that. So I don't like that. So I don't know about you. If you love coffee grounds, then let me know. So I just want to say, I hope you realize that this going on is bad. Simply put, we should never have these antigens, these potential bacteria getting into our bloodstreams and causing inflammation. If this was severe, so leaky gut is not that you have these holes in your bowel per se that are just spewing out bacteria and causing you to go into a bacterial blood infection called sepsis. That's not what it is. That's a more life-threatening event. But this is going to perpetuate illness. And with so much of your immune system contained in here, with so much of your health relying upon the digestion, the reabsorption of nutrients, the elimination of the things we don't want to recycle what's in our stool back into our body. I don't know about you, not me. We want to get the proper nutrients in our food to help support our gut healing as well as health for the rest of our body. So if this is what's going on, it's harder to accomplish that. And so we always have to go back to the gut when we think about this. I want to say that this is going to be quite common. More than 50% of Americans will probably have leaky gut. And we're going to have, again, I want you to realize there is some permeability here, or else we would not have any nutrients reabsorbed into our circulatory system. So it's selective of what's going to be beneficial to us. We just don't want this hyperpermeability that's going to cause illness. So what are some causes of leaky gut? We could have a bacterial overgrowth. Bacteria usually lives pretty harmoniously in our guts as long as the gut is healthy. However, as the health of the gut declines, or if we've had to use antibiotics, bacteria that doesn't need to might overgrow. The bacteria that is just this kind of neither here nor there flora called commensal flora will overgrow and take prominence over your most beneficial bacteria in your gut that helps to keep your gut healthy. And so this can cause inflammation in the gut, and it can cause those junctions in those cells to loosen up. Leaky gut. Food sensitivities. Food sensitivities, if it's causing our immune system to react constantly, that adult immune system, it's going to cause this chronic kind of inflammatory state that is meant to be kind to us to try to take care of the initial insult. But if we're not aware of these sensitivities, it kind of keeps on going, and again, may perpetuate leaky gut. Food additives, this one is interesting. Things like carrageenan and some others. These are made to be like they have bacteria in them that cause their own gluten kind of substance, and essentially will contribute to this inflammation in the gut. Going along with food sensitivities, I want to kind of circle back to that. Speaking about gluten can definitely be associated with this. So even when, aside from celiac, which is a worse condition here, autoimmune condition, that gluten can perpetuate leaky gut. Food additives kind of going along with this, things like pesticides, things like kind of Roundup, glyphosate, tongue-tied here. Those may cause those food sensitivities, and those may be kind of reactive to our gut lining that is fighting so hard to keep out toxins, but may cause that leakiness in the gut. Antibiotics, kind of how I mentioned with the bacterial overgrowth, we have kind of overused and misused antibiotics. When you need them, please take them. Serious infections can be life-threatening, but antibiotics, when not used judiciously, may cause those imbalances of bacteria, may definitely cause a yeast overgrowth. Everything's supposed to be in balance. If you don't have bacteria to keep yeast in check, then you may have a yeast overgrowth, and that can cause leaky gut. You can have serious, just that competitive bacteria. If some antibiotics have the serious side effect of a C. difficile infection. This bacteria can be in your gut normally. It's just when there's nobody else there to keep it in check that this can be a serious infection and cause gut permeability. PPIs are our proton pump inhibitors, things that we take for reflux or heartburn. Think about Nexium, think about omeprazole or Prilosec, Protonix. These are going to contribute to leaky gut. These medicines are really made to just take short term, unless you have a few different conditions that, like Barrett's esophagus, that you need to take this for longer. But these are supposed to be short-term medications. And the chronic use of those acid reducers may impair our ability to break down foods, may impair our ability to reabsorb nutrients, and thus create leaky gut. Ooh, stress. So stress is a big underlying cause of leaky gut, and many of you might laugh because you're like, well, I'm just always going to have leaky gut because stress is just in everything. And how we mitigate stress, we're always going to have it, but it's more about how we're going to deal with it, mitigate it, than just getting rid of it. The stress is going to alter the gut ecology because it's going to kind of decrease your nutrient availability. Because when that fight or flight is turned on, blood is shunted away from your gut. It prioritizes it to the things that are help you fight or fly. And I tell many of my patients, nobody has to poop in the middle of having to run away from a lion, tiger, or bear. Oh my. So when you're shunning blood away from the gut, you're impairing digestion, you're not absorbing nutrients, and you're not eliminating food. So you're leaving this fermentable product just sitting in your gut. And you are what you don't poop. You don't throw out the trash, it's going to start to stink. So we're taxing our immune system because we're also shunting blood away from it. So if you can't get the nutrients We can't support our, our probiotics or bacteria in our gut. If we can't get rid of potential toxins and viruses through waste, we're going to have this perpetual inflammation in our gut lining. We're going to have poor immunity. We're going to have increased symptoms. We're going to have increased fatigue. We're going to have increase in illness. We're going to have potential rashes or acne, and the list goes on. We're not going to have good gut healing with all that stress. NSAIDs, think about your Motrin or ibuprofen, Aleve, naproxen, those are all the same. Think about diclofenac, the prescription ones, meloxicam, Mobic. These are going to perpetuate kind of leaky gut too. At the end of the day, we have to weigh out risk versus benefit. If we're in pain and that's what's causing it, then let's use them. However, if this is a chronic use of these medications, can we decrease those through other healing and decreasing your inflammation in your body? Alcohol consumption. Yep. Alcohol is, they would say kind of the devil is in the dose. Either something is for benefit or a great harm, depending on how much we dig in. So depending on the level of dysfunction and your level of health or your goals, alcohol may not be a good idea for you. Alcohol is a toxin to the body, and having to kind of stress your body to have to deal with detox of it is not kind. Oh, so why does this matter? Yeah. So my gut's leaky. A lot of people have it. There's no way, I'm not going to do anything perfectly. Why should I care? So many conditions are related to leaky gut. And there's going to be a lot of correlations. There's lots of kind of research in the literature gathering data about how intestinal permeability affects our chronic conditions of health. So this is not just going to be about your digestive conditions. This is not just going to be about inflammatory bowel disease like ulcerative colitis or Crohn's colitis, celiac disease, acid reflux, or GERD. It's not just going to be about those. And just because you don't have digestive symptoms doesn't mean you don't have leaky gut. So we get concerned about this because this is going to increase your risk for autoimmune disease. I already mentioned a few of inflammatory bowel diseases. You're going to think about rheumatoid arthritis, lupus. You're going to think about arthritis. Other arthritis conditions can be caused by leaky gut. We can get hives. Lindsay Jost did a talk about kind of histamine and DAO a few weeks ago as a group visit. That will kind of go under why kind of gut health is important for how we do allergies. So I would take a look at that. But so leaky gut can be related to hives, eczema, acne, other rashes, allergies. If you're suffering from environmental allergies, you definitely have to check on your gut health. Mood disorders like like depression, anxiety. So we have more signals going from our gut to our brain than our brain to our gut. If we have inflammation in our gut lining, then that inflammation is going to kind of send a signal. It's going to affect our brain, and it's also going to affect our mental health. You're suffering from chronic fatigue, gut. Look at gut. So also this chronic low-lying inflammation can be associated with obesity. If you're having trouble losing weight, leaky gut. It's going to be associated with brain fog, with swelling, diabetes, cholesterol issues, leaky gut. So how do we heal leaky gut? That's to be continued. Sorry, this was anticlimactic. I want you to kind of understand why this is important. If you're not if you're not sure why this is important, please ask me a question and I will try to clarify this for you. So we can treat this and it will take some time, but we treat each of our patients as unique individuals, one sacred soul at a time. So it depends on your symptoms, it depends on other lab workup. There's testing we can do to look at this because much like a car mechanic, we have to look under the hood or drive the car around to kind of know what's going on. So stool testing, this is why we ask a lot of you to collect your stool. Many people don't want to do that again, but it's very helpful to help us target a treatment regimen to help you. Dietary antigen and food sensitivity testing could be helpful to see what's triggering that immune response continually and what's kind of getting you stuck with the inability to heal. The intestinal barrier assessment is going to look at leaky gut markers of zonulin, histamine to DAO ratio, and an endotoxin made by bacteria called lipopolysaccharide. This is to be continued. Hope to follow this up with the 5R approach to see what we do to work on gut healing. So, guys, a happy gut is a healthy gut, and a healthy gut is a happy gut. Is your gut happy? Is your gut healthy? I just want you to remember that health begins in the gut. If you have issues in your gut, even if we don't have symptoms of gut dysfunction, it is difficult to get you well because of the role our gut plays in nutrient absorption, of digestion, of getting rid of the bad guys, of supporting our immune function. So if you're wondering why we keep going back, if we're just saying, hey, I'm tired, or hey, I have diabetes, or I have arthritis, but I don't have any issues with my poop. I don't have any digestion issues. We're like, well, we'd like for you to do this stool test, or I'd like for you to do an elimination diet. This is why we have a great suspicion of gut dysfunction. So, if you have any questions, please let me know. Thank you for spending time with me today. I really do appreciate you taking the time to attend. So, okay. Thank you so much for that comment. I do appreciate that. Thank you. Wow, this is a really good question. How long could we expect this to take to resolve? Ooh, this is gonna depend on every individual. So in some instances, I want you to expect a long haul. I want you to expect at least a year. I know, a long time. And what I have found is depending on the current state my patients are in, it kind of depends on the length of time that's for the gut to heal. And I like to think of this as a continuum at some point because we're going to be subject to stress, you know, if things, the wheels kind of fall off of life during certain events, then that might increase our dietary decisions, might decrease, we might have more inflammatory foods. We're going to go for those convenience foods, fast food. So if we have to have antibiotics, we don't want to fear them, but we want to potentially, you know, please ask your clinician about what can I do? I need to take this antibiotic. I'll go ahead and tell you that I would recommend taking Saccharomyces boulardii, a yeast that's an anti-yeast. We use that as C defense. You would take 1 capsule twice a day during the duration of your antibiotic to help protect against the side effects, the unwanted side effects that antibiotics may produce. If your leaky gut is caused by bacterial overgrowth or SIBO, SIBO has a very high recurrence rate. And this is going to be an ongoing kind of issue and struggle. So kind of my answer to how long does it take to heal, it's going to depend on where you start and what degree of dysfunction is measured. And then that's going to kind of depend on how long this takes to heal. So I want you to anticipate at least a year, but it may vary. So are you asking what do I do to maintain a healthy gut? So we're kind of, you know, little sneak peek into kind of the next group visit I plan to do, or maybe somebody else will still it before me. But what I do to maintain a healthy gut is fiber. I try to make sure I consume at least 25 to 35 grams of dietary fiber a day. I do not take an additional supplement for that. I get it through a variety of vegetables, fruits. I love broccoli, Brussels sprouts, cabbage. I like lots of berries, blueberry, blackberry, raspberries. I do gluten-free oats that have a lot of fiber, add flaxseed to my smoothies. So the variety of our diet helps to feed those gut bacteria, which help for those gut bacteria to make healthy short-chain fatty acids, which help to improve gut healing and function. Take omega-3 fatty acids every day. I try to make sure I adequately hydrate. I take a probiotic. Probiotics should not just be taken just because. I would try to talk about that with your clinician if that would benefit you. I use digestive enzymes occasionally. If we can help break down the food, it's going to be easier on our bodies and it's going to be less inflammatory. So those are a few things that fit into the approach of healing leaky gut. That's kind of how I maintain a healthy gut. One indicator of healthy gut function is going to be, are you eliminating every day? Do you have a bowel movement? Are you pooping? You want your poop, the question here is to say, does your poop look like stones or rocks? Does it look like logs? Does it look like a snake, pudding, or tea? Ideally, our stool is going to look like snakes. I know that's kind of gross to kind of talk about that much about poop, but this is going to be an indicator of how healthy your gut is when it gets everything it needs. Does fasting help with leaky gut? And what does intermittent fasting do to your gut health? Oh, fasting is wonderful for your gut health. And I like to frame it this way. Do you like working 24 hours a day, 7 days a week? No, neither do I. I like to take breaks, long breaks. So we can see increases, and it's kind of like, it's called gut rest when we have fasting. There's so many kind of different benefits to cellular health and doing fasting. I would look at Cliff Siner's last group visit, but gut rest is letting your gut take some time off. So just like you don't want to work all the time, that you like to take some time off for some leisure activities and rest, your gut appreciates it too. And sometimes our gut needs more rest than 8 hours a day. So practicing fasting, either depending on who you're seeing, they may recommend a water fast or a 3-day water fast, even like a fasting mimicking diet that can create this very similar situation there. Also, intermittent fasting, you're going to give your gut a nice 16-hour a day rest. So your gut is going to benefit from fasting. So again, fasting, I'd have to know your health history, would have to think about if you're on any kind of medicines for diabetes that might lower your blood sugar, we have to think about that a little bit differently. But yeah, I hope that answered your question on that. So, big fan of fasting for gut health, but how you do that is important too. So, okay. And if that is all the questions we have, oh, another one. If your fungi in your system is out of balance, what can you do with your food and gut to help reduce the fungi? So this is going to be very specific, and I would definitely talk to your physician on that. So there are funguses we're exposed to on our foods. It depends on what that is. If we're talking about yeast, we want to have a kind of low candida diet, and that's going to get fermentable foods out. It's also going to decrease things that are high in sugar, high in starches, because those things are gonna feed those things to grow. Potentially use of kind of natural antifungals or medications may be beneficial. It depends on the severity of that situation. Also, may be important to get out aspergillus foods in the diet. So I would talk to, if you haven't met with a dietitian yet, I would kind of talk to her about that. So that's a very kind of good question. And it kind of depends on the particulars here. So yeah, if I did not answer that question sufficiently, please reach out to your clinician. But you all have had a lot of great questions, and you don't know how much I appreciate that, because I appreciate your interaction. I really do enjoy doing these and getting to speak to our patients about topics that matter. I would like to know as well, like what else the patients want to know about topics in functional medicine or that matter to their health. So I do, again, appreciate all your questions. Thank you for spending this time with me. And I look forward to the next time when I will talk about the approach to healing leaky gut. So remember, health begins in the gut. If you do not have a healthy gut, it's harder to heal the rest of the body.